Physics-based comparison of blood pressure waves and glucose waves, number 1350, September 7, 2025, Gerald C. Shu, EclaireMD Foundation, Category, Concepts. Preface. This article is part of my self-learning in internal medicine. I applied my background in mathematics and physics, from college to better understand biomedical phenomena. In this paper, I use wave theory, from physics to explain the ups and downs of both blood pressure and glucose waves. Introduction. In medicine, both blood pressure, BP, and glucose levels are essential biomarkers of chronic disease risk. They are typically analyzed through statistical averages, such as systolic, diastolic values or HbA1c, yet such measures conceal their underlying physical dynamics. From a physics perspective, both BP and glucose exhibit oscillatory behaviors that resemble waves. Each system has distinct frequencies, amplitudes, and waveforms, and each dissipates energy across multiple time scales, seconds, minutes, hours, days, months, quarters, or years. BP waves are mechanical oscillations generated by the heart's rhythmic pumping, whereas glucose waves are metabolic, biochemical, oscillations driven by food intake, hormonal regulation, physical activity, and tissue absorption. Comparing them through the framework of wave theory and physics, including frequency, amplitude, resonance, damping, phase, and plasticity, provides deeper insights into their influence on both acute, physiological function and chronic disease progression, pathology. Frequency and time scales. Frequency defines how many cycles occur in a given time. Blood pressure waves, each heartbeat generates a wave, giving a fundamental frequency near 1 Hz at 60 beats per minute. Higher heart rates shift the frequency proportionally. These oscillations are in the range of audible sound and comparable to low-frequency mechanical vibrations. Glucose waves, these waves operate at ultra-low frequencies. A postprandial cycle spans from 2 to 4 hours, translating to about from 0.0001 to 0.0003 Hz. Even circadian glucose rhythms, day-night variations, remain in this extremely low band. Thus, BP is a high-frequency oscillatory system, while glucose is a slow, low-frequency system. BP cycles are about 10,000 times faster than glucose cycles. This frequency gap mirrors the difference between rapid vibrations of a guitar string. BP wave versus slow ocean tides, glucose wave. Waveform shapes and harmonics. Waveform analysis highlights further contrasts. BP waveform, characterized by a sharp systolic rise, peak, and diastolic decay. The sudden upstroke introduces higher harmonics, so the waveform is not a simple sine wave, but a composite of fundamental and overtone frequencies. Reflections from arterial bifurcations add constructive or destructive interference, modifying the waveform as it propagates. Glucose waveform. The shape is smooth, rounded, and closer to a Gaussian or sigmoid curve. The rise is gradual and the decay slow, with little harmonic structure. Glucose lacks periodic sharp transitions, so it is dominated by low-frequency content with minimal higher harmonics. BP resembles a pulse train with sharp edges and rich harmonic content, while glucose resembles a slow, damped oscillation with only fundamental low-frequency components. Resonance and phase. Physics teaches that waves interact with system properties, such as resonance and phase. Blood pressure. Arteries act like elastic tubes that can resonate at certain frequencies. In young elastic vessels, the reflected waves arrive in diastole, boosting coronary perfusion. With aging and stiffness, reflections arrive earlier, shifting phase and adding to systolic load. This resonance shift increases systolic pressure and widens pulse pressure. Glucose. There is no mechanical resonance, but there is metabolic resonance with circadian rhythms. Meal timing relative to circadian insulin sensitivity creates phase alignment or misalignment. For example, eating late at night when insulin sensitivity is lowest produces exaggerated peaks, equivalent to a phase mismatch in oscillatory systems. BP resonance is mechanical, glucose resonance is metabolic and circadian. Both illustrate how phase relationships influence energy load on the body. Damping and energy dissipation. Waves energy through damping. Blood pressure. Damping occurs through blood viscosity and vessel wall friction. As waves move from central arteries to peripheral arterioles, high-frequency components are filtered out. This smoothing protects capillaries from sharp pressure pulses. Short-term damping is elastic, but over decades, permanent structural changes accumulate, introducing plasticity. This means the vascular system gradually stops bouncing back fully, like elastic material. Over decades of aging process, small irreversible deformations build up, so the structure changes shape or function permanently, that is plasticity. Glucose. Damping occurs through insulin action, and cells absorbing glucose from the blood for energy or storage. After a glucose surge, insulin lowers the amplitude of the wave. However, damping efficiency varies. In healthy individuals it is strong, but in diabetes it weakens, prolonging oscillations. Importantly, every cycle dissipates energy into metabolic damage, making the process partly irreversible. Thus, BP damping is primarily viscoelastic, while glucose damping is nonlinear, delayed, and permanently footprinted, i.e., irreversible damaged. Elasticity, plasticity, and viscoplastic behavior. Elasticity describes reversible deformation, while plasticity describes permanent change. BP waves. In the short term, arteries are elastic, stretching and recoiling each beat. Over years, repeated stress causes remodeling, fibrosis, and calcification. This creates plastic changes, permanent stiffening that alters wave speed and shape. Therefore, blood or Reschuti waves are viscoelastic in the short term, but viscoplastic in the long term. Glucose waves. These diabetes waves are inherently plastic. Each excursion leaves irreversible changes in beta cell function, endothelial health, and insulin sensitivity. Even if glucose levels return to baseline, the tissue has absorbed damage. Plasticity dominates over elasticity in glucose case, making the diabetic system asymmetric and irreversible. This contrast highlights why aging arteries stiffen, plastic remodeling, and why chronic hyperglycemia progresses to complications. Cumulative plastic harm. Energy and wave theory interpretation. Energy transfer provides another unifying lens. Blood pressure. Each heartbeat injects kinetic and potential energy into the arterial system. Energy is stored elastically in vessel walls, and dissipated through viscous friction. Wave energy is high per cycle but low in long-term plastic accumulation. Glucose. Each glucose wave represents chemical energy from food intake. Excess energy not immediately used is stored as fat or causes oxidative stress. Unlike BP, where elastic recovery is substantial, glucose energy waves always leave behind some irreversible residue, i.e., damage. The cumulative energy of thousands of glucose waves over the years contributes to metabolic syndrome and chronic diseases, including not only diabetes but also neurological and retinal damage, as well as cardiovascular and renal disorders. BP is a high-frequency, low-plasticity energy system, while glucose is a low-frequency, high-plasticity energy system. Clinical implications. Understanding wave behavior has practical consequences. BP monitoring. Because BP oscillates quickly, continuous monitoring over minutes reveals cardiovascular stress, waveform distortion or early return of reflected waves, signals vascular stiffening. Treatments aim to reduce amplitude and shift phase to safer patterns. Glucose monitoring. Because glucose waves are slow, continuous glucose monitoring over days is necessary. Flattening the wave through diet, exercise, or medication reduces cumulative plastic damage. In both systems, managing amplitude and damping of fluctuations is critical. For blood pressure, lowering peak systolic load helps prevent arterial stiffening and reduces stroke risk. For glucose, limiting peak excursions helps prevent metabolic damage and lowers the risk of developing multiple life-threatening diseases. Systems-based perspective. Traditional statistical tools reduce these dynamic processes to averages, such as mean blood pressure values or HbA1c values. While these averages are useful, they erase the underlying waveforms, frequencies, and viscoplastic features. A systems-based approach informed by wave theory retains these elements. It clarifies why chronic diseases emerge not from single events, but from repeated oscillations, each leaving an incremental footprint. By treating BP and glucose as waves, medicine can better integrate physics, principles, frequency analysis, harmonic content, resonance, damping, and energy dissipation, into chronic disease modeling. This aligns with the viscoplastic energy research, VMT, framework, which accounts for nonlinear, dynamic, and irreversible behaviors that conventional statistics cannot capture.